These antibody therapies for coronavirus are approved for emergency use, but hundreds of thousands of the doses are sitting around unused this morning. There are a lot of reasons why this is happening. The first one is some infectious disease doctors have been hesitant about even using these treatments. They're calling for more clinical trial data. The National Institutes of Health and the Infectious Disease Society of America have both said there's really not enough data in their view to recommend either one of the treatments. It is suggested if someone's considering either antibody drug, they should ask their doctor about a clinical trial.
You may or may not get the agent, but at least it will give us data as to whether these agents actually work for you and for others.
Others have said that COVID-19 patients really aren't getting into the hospital during the first week that they get sick, and that's really when these antibody treatments work the best. Administering the treatments can also be challenging because it has to be done at an IV center.
That would be safe for providers and for patients, but we just can't get the staffing or haven't been able to get it up and running to date.
There's also some confusion about the cost. The doses themselves are free thanks to a deal between drug makers and the federal government. But depending on insurance coverage, you as a patient could still have to pay for having the drug administered to you via IV. There's also been an issue with some of the supply. According to the Department of Health and Human Services, there are more than 530,000 doses available, but only a little over half have been shipped to hospitals, and only about 5 to 20% of those doses have